Efinaconazole belongs to the class of medications called antifungal agents. It is used to treat mild to moderate fungal infections of the toenails. Indication: Jublia efinaconazole topical solution 10% is prescription medicine used to treat fungal infections of the toenails. How should I use this medication? 1 drop of efinaconazole is applied to the surface of each affected toenail once a daily, preferably at bedtime. If you are treating the big toenail, apply a second drop to the end of the toenail using the tip of the brush. Before applying the solution to the toenails, wash and dry the affected area. Wait for at least 10 minutes before applying efinaconazole. Use the applicator brush to spread the solution to cover the toenail and the skin immediately around the nail, including the skin underneath the nail. Do not squeeze the bottle while spreading the solution. Allow the solution to completely dry before touching the area with sheets, socks, or other clothing. Wash your hands with soap after applying this medication. Continue to use this medication for the full length of time recommended by your doctor. If you stop treatment too soon, the infection may return and be harder to treat. Avoid contact of this medication with eyes, mouth, nose, lips, or open wounds. In the event of accidental contact, rinse thoroughly with water. Many things can affect the dose of medication that a person needs. If your doctor has recommended a dose different from the ones listed here, do not change the way that you are taking the medication without consulting your doctor. It is important to take this medication exactly as prescribed by your doctor. Who should not take this medication? Do not use this medication if you are allergic to efinaconazole or any ingredients of the medication. What side effects are possible with this medication? Contact your doctor if you experience the side effects and they are severe or bothersome. Your pharmacist may be able to advise you on managing side effects. Skin irritation around the toenail, burning, redness, itching, stinging. Check with your doctor as soon as possible if any of the following side effects occur: blisters of crusts around the application site, skin rash, swollen skin around the affected area. Are there any other precautions or warnings for this medication? Hygiene. Toenails should be clipped every 4 weeks. Clip the unaffected toenails before clipping the affected nails. Discard the clippings and clean the toenails clippers after each use. Do not share your clippers with other people to avoid spreading the infection. Pregnancy. This medication should not be used during pregnancy unless the benefits outweigh the risk. If you become pregnant while taking this medication, contact your doctor immediately. Breastfeeding. It is not known if efinaconazole passes into breast milk. If you are a breastfeeding mother and are taking this medication, it may affect your baby. Talk to your doctor about whether you shall continue breastfeeding.